everybody knows, oh, I have to go to the dentist to get a checkup. Oh, I have to go see my primary care physician to get a follow-up. Not everybody knows that they could go see a physical therapist and get an assessment on their movement or their posture and can be seen with direct access. My name is Earl Aliparo. I'm a physical therapist and I am providing private home care physical therapy. I've been doing physical therapy for about 3 years. I've been working in private outpatient practices as well as hospital-based outpatient practices. I recently started doing home care physical therapy and decided that I wanted to do it privately. That they would be coming to me directly via direct access, meaning that they wouldn't need the prescription right away to see physical therapy. They could just come right to me. And then from there, after a thorough evaluation, I can decide whether it would be appropriate for me to treat them or if I would have to refer them out. So I would pretty much reduce the steps that they would have to take in seeing an orthopedist, getting an MRI, seeing pain management, and all of those things. It would be a cash-based practice that I'm really running more so. So the convenience is that I would be going to the patient's home, so they wouldn't have to go to find their primary care physician, then followed by an orthopedist, and then looking for a physical therapist. I would be the guy that they would pretty much have to call, and then I could come by and conduct the evaluation and decide whether it'd be appropriate for me to treat them or not. I would conduct the appropriate therapeutic exercises that I feel would be beneficial for them, as well as giving them homework to continue it at home. So my goal is to make the patient as independent as possible with their exercises, and from there we will progress appropriately on whether they're benefiting from it or not. Physical therapists might see maybe 3 patients within the hour. So that means they're spending maybe 15 to 20 minutes with a patient. If the patient saw me for that hour slot, they'll see me one-to-one. And for that one-to-one time, I feel there's more benefit there than dividing my time between, 2 to 3 patients within that hour. So it stemmed from my peers getting injured when I was younger, and that's why I decided to get into physical therapy at a younger age. And then as I've gotten older and I've seen more injuries happen in sports or movement-based in the gym, or even just as our family and friends have been aging, people don't heal as quick. And I feel that physical therapy, is one of those things that without taking medicine or getting surgery, it's a preventative measure, for people to move better and with decreased pain. I feel like people just don't know that what physical therapy does or what's out there, or they have to wait till they see their physician to actually go get physical therapy. Most of the time when my patients have come to me in the other settings that I've been in, I would ask them, have you received physical therapy before? And most of the time it's like, yeah, my doctor wrote me a prescription and then I went to go get physical therapy. It's not necessarily that they know. They don't need a physician's prescription to get physical therapy per se. Once I've actually treated the patients, they say, wow, I kind of wish I knew that this was available, or I knew that this is what was going to get me better. And after a handful of sessions, most of the time their movement has improved, their pain has decreased. But if there is no improvement, in which case fine, then we will refer them appropriately to the right medical professional. But for the most part, within a handful of sessions, most patients do improve with physical therapy. Physical therapists are out there to provide treatment for you guys, especially for the CrossFit athlete. It's been out there now that, some physical therapists are setting up in boxes and, they're getting people better within a handful of visits. So, we're out there.